The day that a calf is born is going to be the highest risk day of its entire life. So it's important producers are prepared with some tools that they can use to help keep calves alive. The first thing we're going to want to do is put that calf in the calf recovery position. That means getting it up on its chest and pulling its back legs up towards its armpits. And what this does is allows both of those lungs equal opportunity to expand and fill with air, and putting those legs forward means that that calf is stable and it can't just flop back over onto its side. The next thing we're going to want to do is take a clean hand and remove any fetal fluids that might be in that calf's mouth, because we don't want anything in there that's going to be in the way of that calf bringing air into the lungs. If it doesn't breathe right away, we can then stimulate it by rubbing it vigorously. We can stick a finger in its ear, give it a wet willy. We can pinch the nose, give that head a little shake. We can also use a piece of pokey straw to poke the nasal septum, which is that piece of tissue that separates the two nostrils on the inside. We can either splash some water on the back of the calf's neck or on its face, or we can squirt a little bit of water into the ear. Not too much or too hard, because we don't want to create ear infections, but that just tricks the body into thinking that the calf might be drowning. So they gasp and they fill those lungs with air. If they're not breathing and they don't have a heartbeat, odds are that calf's not viable, so there's not too much we can do. But as long as there's a heartbeat, I'm going to keep trying to get them to breathe. What we don't want to do is hang calves over a gate. This has been something people have done traditionally because you end up getting fluid that drains out of the calf's mouth. Unfortunately, this fluid isn't coming from the lungs like people always believed. It's actually mostly coming from the stomach. So it's not achieving what we think it's achieving. The other thing that it does do, though, is gravity is then pushing the abdominal contents, or the intestines of this calf, down against the diaphragm, actually making it harder for those lungs to expand.
This technique is something very simple and easy to incorporate. Every once in a while we kind of uncover a stone and realize that there's a new, better way to do things.